In this video, I will explain what the training consists of and what it will bring you. What you will gain is a much more effective way of working, more varied and more satisfying, much quicker and longer lasting results for acute or chronic pain from the musculoskeletal system. I will give you some examples of my students' successes, so this is what you too will be able to accomplish quickly. First of all, a 75-year-old patient presents with a broad, unique pain resembling left sciatica, acute and worsened at rest. So the pain is of the yin type. I stimulate the corresponding wushu point 4 times and the patient no longer feels pain. The wushu points are special points that we will of course explain in the training, including their usefulness and how to use them. Another case, a patient with very sharp pain in the right knee. On the ultrasound, there's an effusion, and at the clinic, there's pain, redness, and warmth. I start with the barriers. There's an upward yin blocked at the knee, and after 2 stimulations of the corresponding point, miracle, no more limping, no more pain, just a bit of discomfort while walking. I see her again the next day after a nighttime reaction that worsened but was relieved by movement. So I decide to address the stagnation point of yin from the lower part of the body. And there, after 2 stimulations, it's done, finished, no more pain, the patient leaves, delighted. Another case, a patient with suspected frozen shoulder. The left shoulder is limited in all its ranges of motion. The energetic diagnosis shows a barrier of centrifugal yang blocked at the shoulder. I locate the corresponding point, stimulate it once, and there's an instant improvement. After 4 stimulations, there's no more pain. The basic principle, which is too often forgotten in acupuncture, is that all pain is due to a disruption in the flow of the body's energy. Now, there are several types of possible energy disturbances, about half a dozen plus the most common combinations. In Acu AnMo, each disturbance and each location corresponds to a different and specific treatment point. In present-day China and most schools, they don't even understand fundamental concepts like the barriers that are the primary cause of joint pain. The meaning of acupuncture term Quan is unknown. This word appears in the names of many points, which actually gives an indication of their actions. Hence, the other big difference. Not only in Acu AnMo can we understand which energy disturbance is causing the pain. Different causes from one person to another, but we also know the specific energetic action of each point we use, which allows us to stimulate only one at a time, check its effectiveness immediately, and repeat it during the session, as long as it improves the patient, ideally until recovery. The often spectacular effectiveness of the Acu AnMo method comes from the fact that, unlike the acupuncture usually taught, we always proceed in a logical manner. Simple and rigorous, without a one-size-fits-all recipe, but based on the fundamental principle that all pain is due to a disruption in the body's energy flow. We proceed as follows. First, the patient's symptoms are translated according to the nature of the pain into diagnoses of disruptions in the energy flow. The diagnosis is individualized by comparing symptoms to a reference framework. We will stimulate using a stylus at one point. Just one point, the one that corresponds to this energy diagnosis. And we can do this because, unlike traditional schools, we understand the energetic effect of each point used, which is never chosen based on a list, a disappointing recipe, identical for everyone. And unlike traditional schools, we immediately test the effect of the stimulated point and we repeat it, as long as it improves the patient, ideally until healing. Otherwise, we do the same for the disruption that was associated. And it's how to easily do all of this that is taught in detail in the training. It's also the simplicity of the method that allows for its effectiveness. So why do we use a stylus? On one hand, practical results show that it's much more effective than needles. And since we immediately repeat the stimulation of the effective point, it wouldn't be very pleasant for the patient to be pricked repeatedly, the same place. In short, we offer you in the online AnMo training what you won't find anywhere else. I will now present the content of this training. It's a comprehensive training in Acu AnMo that consists of 13 videos. Every 2 weeks, we send you the link for the next video, which gives you all the time you need to absorb the new concepts and apply them. Each video comes with a PDF resource that we send you at the same time. The program of the 13 videos is as follows. For the first one, we cover the theoretical foundations of Acu AnMo, and in the second one, we start what will span over 3 videos, that is to say, the barriers. In video 2, we will look at the generalities regarding barriers and the pains in the upper limb, shoulder, elbow, or wrist. In the third video, we will look at the barriers of the lower limb, the pains in the hip, knee, and ankles, as well as the lower back pain. And finally, in the fourth video, we will look at the barriers of the head and neck. In the fifth video, we will look at the voids, the cause of multiple pains. In the sixth video, we will look at the stagnations of yin. In summary, these are the pains that worsen at rest or worsen at night. The seventh video presents the excesses of yang, pains that are, this time, worsened by movement. The eighth one, blood stasis, essentially the old pains. The ninth video will present the meridians and linear pains. The 10th video will present the muscular territories and the control points, called wushu points, as well as the treatment of linear pains. For the 11th video, we will look at the pains that may be aggravated by climatic factors and dietary causes. The 12th video will cover the pension, which means pains with a psychological factor. And finally, in the 13th video, we will revisit the protocol, we will summarize, and we will give examples of the different possible causes and treatments for lower back pain. The advantage of our online teaching is, on one hand, the excellent results. All the clinical cases we mentioned earlier were sent in by students who completed their training online. So that's what you can also achieve. Additionally, you have the option to watch the videos multiple times. And finally, you won't have any travel expenses or costs for closing your practice, of course. I will now share some testimonials from therapists who have completed the training. On one hand, an acupuncturist shares the following testimonial: clear and educational training with good support, with the possibility to ask questions via email and regular Zoom meetings to refine the details. Extraordinary technique that opens up new horizons and allows us to relieve our patients in a simple and often immediate way, even for complex, long-standing conditions. The opinion of a Chinese medicine practitioner, the teachings of Dr. Pollack are essential for managing musculoskeletal pain. The application is astonishingly effective. I have reviewed all my strategies in Chinese medicine since my Acu AnMo training. If you wish, you will find many more testimonials on our website, acuanmo.com. In fact, I'm giving you the result of 45 years of research in the field of acupuncture for musculoskeletal pain. This is exactly the training I wish I had when I started. Indeed, don't forget that most of the practical concepts from my course are not taught anywhere else, because they are misunderstood or completely unknown there. And it is precisely these concepts that make acupuncture effective according to the Acu AnMo method. I hope you enjoyed this video, and I look forward to meeting you during the Q&A sessions scheduled in the course.